Have you ever experienced joint discomfort that just did not feel right? Perhaps a joint that looked puffier than usual or felt unusually warm. It is common to wonder when these signs are just a temporary ache and when they might be signaling something more serious. When it comes to joint swelling and redness, it is time to worry and consult a healthcare professional if these symptoms are persistent, unexplained, and especially if they are accompanied by significant pain or stiffness or affect multiple joints. These can be crucial indicators of an underlying inflammatory condition, such as rheumatoid arthritis. The reason these specific symptoms raise a red flag is because they point to inflammation within the joint, not just mechanical strain or minor injury. Swelling, known medically as edema, occurs when fluid accumulates in the joint capsule, often due to an inflammatory response. Redness or erythema and warmth are direct results of increased blood flow to the area as the body attempts to heal or fight off an issue, which is characteristic of inflammation. Unlike a simple sprain, inflammatory joint issues often present with these visible signs even without a clear injury. So, how can you tell the difference and when should you seek help? Pay close attention to the characteristics of your symptoms. If the swelling and redness appear suddenly, last for more than a few days, or affect the same joint repeatedly, it is worth a medical evaluation. Also, notice if the symptoms are worse in the morning or after periods of inactivity, or if they impact your ability to move the joint through its full range. Keeping a brief journal of when these symptoms occur and their intensity can be very helpful when speaking with your doctor. An important distinction to recognize is that inflammatory joint swelling often feels soft or spongy to the touch, and the redness can be widespread around the joint, sometimes accompanied by a noticeable increase in skin temperature. This differs from bony enlargements that might occur with conditions like osteoarthritis, which are typically harder and not necessarily warm or red. Understanding these subtle yet significant differences helps pinpoint the nature of the problem. Ultimately, persistent joint swelling and redness are your body's way of telling you that something is not quite right, especially when other common causes are ruled out. By being proactive and seeking timely medical advice, you empower yourself to get an accurate diagnosis and begin appropriate management, helping to protect your joint health and overall well-being. It is always better to have peace of mind and address potential issues early on.